Hello, my name is Jose Mattos, and I'm one of the rhinologists here at UVA. I also recently took on the role of Associate Program Director. Rhinology at UVA encompasses the whole clinical spectrum, from in-office procedures, medical management of complex CRS patients, revision sinus surgery, and advanced skull-base resections. From a research perspective, my personal interests are the investigation of smell and taste disorders and prospective outcomes research in sinus and skull-base surgery. UVA is one of 5 sites nationwide that helps coordinate one of the largest CRS cohorts in the world. I think UVA is a great place to train and spend these very important 5 years of your life. The resident experience and resident education are at the heart of everything we do. And whatever your interests are, clinically or academically, you will be able to explore them fully here. I look forward to meeting you and getting to know you better. See you all soon. Thank you.
Hey, my name is Pat McGarry. I'm a laryngologist. I'm part of the Division of Laryngology, and that includes my partner, Jim Dinero, who founded the UVA Voice and Swallowing Center, our PA, Sam Olds, and our team of speech pathologists who work with us in clinic in an interdisciplinary fashion. I did my residency training here at UVA and did a laryngology fellowship in San Antonio, Texas, before returning here to join the faculty. One thing that really makes working at UVA so rewarding is all the colleagues we work with in other specialties and our own team members really lean in to patient care and go the distance. And it really is satisfying to be able to see the high level of quality that we can achieve when we work together. Some of the research I'm working on, we have a few systematic reviews in laryngology going right now. We're also working on a multi-center retrospective study on endotracheal tube-related acute laryngeal injury and posterior glottic stenosis. It's really exciting to teach and to help the residents get to the next level of their training, whether it's nailing down the workup of a particular chief complaint in clinic or helping them really feel comfortable with that step of the surgical procedure they just haven't gotten quite right. It just never gets old, and it's really fun to be part of that progress and see them get better and better. Outside of work, I have a 3-year-old and I'm married, so that keeps me pretty busy. I love trail running with my dog, anything outdoors, fly fishing, do a lot of cutting and splitting of firewood, and I've started dabbling in some amateur woodworking and furniture refinishing. This is a really exciting time for you all, and I know it can feel a little daunting, but we can't wait to meet you all and wish you the best of luck.
Hi everyone, my name is Brad Kesser, and I'm the Program Director for the Department of Otolaryngology at the University of Virginia. I'm sorry we can't interview you in person this year, but these are strange times indeed. I'd still like to welcome you to the ENT department at UVA. The department is divided into teams. We have the head neck oncology team, the otology-rhinology team, the facial plastics and laryngology team, and the pediatrics team. So in no particular order, I'd like to introduce you to head neck oncology team. Mark Jameson is the chief. Dr. Jameson is an outstanding head and neck surgeon skilled in microvascular free flap reconstruction. His colleagues include Dr. Katie Fetter, Dr. John Garneau, who just joined our faculty last month, and Dr. David Shanka, who is a nationally renowned thyroid parathyroid surgeon. The otology-rhinology team is composed of me, Brad Kesser, and my chief, Dr. George Hashisaki, along with the Director of Audiology, Dr. Tucker Gleason. On the rhinology side, Dr. Spencer Payne is the chief of rhinology, with his colleague, Dr. Jose Mattos. In the facial plastic surgery side, I want to introduce our chair, whom you've probably already met, Dr. Stephen Park, and we'll be joined by Dr. Sam Oyer in October for facial plastics. On the laryngology side, Dr. Jim Dinero is the chief of laryngology, and he's joined by his colleague, Dr. Pat McGarry. And finally, Dr. Steve Early is the chief of our pediatrics division, and he's joined by his colleague, Dr. Will Brand. So you see, we have a very well-rounded department. Almost all of our attendings are fellowship trained, and I would have to say the strength of our department is in its faculty. We are engaged and invested in your education. You will get a very broad and deep education in both clinical and management and surgical management of patients with otolaryngology complaints. I promise you, we will not leave you out on an island in a room all by yourself doing an operation that you don't feel comfortable doing. We, of course, are committed to a graduated level of responsibility. So for example, in a cochlear implant operation, the junior resident might open the mastoid and drill the mastoidectomy. An upper level resident might find the facial nerve and open the facial recess, and then a senior or chief resident would drill the cochleostomy and place the cochlear implant. So we really do concentrate on your education through a graduated level of responsibility. The rotation structure that you'll enjoy over the course of your 5-year residency at UVA includes a PGY 1 year where you're with us for 6 months out of the year. The other 6 months are in off-service rotations, including neurosurgery, an intensive care unit, thoracic surgery, and general surgery rotations. In the PGY 2 year, you'll spend time as the consult resident. There's a lot of learning experience seeing patient consults, both in the emergency department and in the hospital setting. So as the consult resident, you'll take care of the inpatients on our service, as well as be the initial face of our department to the rest of the hospital world. You'll see the emergency department consults and the inpatient consults, and I will promise you, you will have backup in the form of both a senior or chief resident, as well as an attending. The PGY 2 year also contains rotations on all of the teams, finishing out the year with a 2-month rotation on the pediatric service, where you are the chief. And that gives you an excellent opportunity to take ownership of patients, ownership of the service, and work directly with Drs. Early and Brand. In the PGY 3 year, there are additional rotations on the teams, plus a 4-month research block. The research block can be either basic science, or it can be an applied research, such as cost sharing or a cost analysis. You can do clinical study. We will help you with both basic science and the clinical research. In the PGY 4 year, again, you're now a senior resident and you take call from home. You also rotate on the different teams. But one highlight of the PGY 4 year is a 3-month rotation in Fredericksburg. When I finished my training, after I finished my fellowship, I joined a private practice in Atlanta. I was in that private practice for 4 years, yet I had really no education on how to run a business or how to be in a private practice. I feel as a program director, it's very important that you learn how a private practice runs. And we have an excellent colleague, Dr. Nariman Dash in Fredericksburg, which is only about an hour and a half away, that has welcomed our residents for the last 4 or 5 years to join his private practice. Not only will you see patients with Dr. Dash and his partners, you'll operate with Dr. Dash and his partners, but you'll really learn the business, or how to run a business and how to run a private practice. I think it's a very valuable rotation. The final year is the PGY 5 Chief Resident year. Again, you'll take call from home and you'll be the Chief Resident on the Head Neck Oncology Service for 4 months, on the Otolaryngology-Rhinology Service for 4 months, and on the Laryngology Facial Plastic Surgery Service for 4 months. There's a bit of administration and there are a lot of moving parts, but we feel at that level you're ready to take on the role of a manager as well as an educator, because you will be educating and we will teach you how to teach your junior residents and your medical students. In terms of salary structure and the GME basics, you can see the slide that has the salary structure, the health and medical benefits, as well as parking. So I won't belabor that point at this time. In terms of didactics, we have a number of different conferences that occur both on a weekly and on a monthly basis. Another didactic is our Grand Rounds, which we have Wednesday morning, 7 a.m. to 9 a.m. It's a 2-hour structured didactic with lectures from the faculty. You all will give lectures, and from faculty from around the University Medical Center. That 2-hour Wednesday morning didactic is an excellent series of conferences to give you the bread and butter of otolaryngology. We have a monthly journal club, which has been revamped. Pick a question, canal wall up versus canal wall down mastoidectomy, and let's have a debate using evidence-based medicine to determine which are best practices. That journal club has been led by Dr. Jose Mattos, one of our rhinologists, and has been a real excellent didactic session for our residents and for our faculty. We'll also talk about scientific methodology. case control studies, cohort studies, randomized controlled trials. So you'll also learn the science of research. We have monthly patient safety and quality improvement grand rounds where we present, it used to be called morbidity and mortality, but we present patients who have had complications from surgery and we discuss them in a very collegial and supportive environment. We also have a patient safety and quality improvement grand rounds, which occurs once a year. That's usually in February or March, where you will partner with one of your other residents to present a quality project. The quality project could range anywhere from who gets an influenza shot before leaving the hospital on our service, to how long do patients have to wait in our clinic before being seen, to how efficient are we in our first time starts in the operating room. The patient safety and quality grand rounds is an excellent part of your education and really teaches you about systems-based practice. We also have our graduation, which is called the Fitzhugh Symposium. It's a series of lectures. You'll give your research presentation that you've done over the course of the year, as well as drill a temporal bone for the annual temporal bone drilling contest. We have visiting professors through the course of the year. The Jarsdorfer visiting professor is in the spring. We have a head and neck visiting professor and a facial plastic surgery visiting professor. Those days are great because you're relieved of all of your clinical duties to be with that professor for an entire day. We faculty manage our own operating rooms, we do our own clinics, so that you can spend time with the visiting professor and learn all you can. It's generally capped by a keynote lecture in the afternoon. I think our department is extremely well-rounded. I promise you will get the depth and breadth of otolaryngology education, and by the time you finish our residency, you will be capable of practicing independently without direct supervision. I'm happy to answer any questions that you have along the way. My email address is bwk Bravo Whiskey Kilo, the number 2, the letter N for November, at Virginia, virginia.edu. I really hope you'll give our program a good hard look. I think things that differentiate our program include the opportunities in facial plastic surgery, the opportunities in head and neck oncology, the opportunities to see children with congenital ears, which is near and dear to my heart, oral atresia. So in summary, I thank you for listening to this video. Please feel free to ask questions. We're open. We're sorry we can't meet you in person, but we wish you all the best in the upcoming match, and know that if you come and match at the University of Virginia, you will receive excellent education from a faculty that is dedicated, invested, and engaged in your overall maturation and your development and evolution into a surgeon. Thanks a lot for listening.